Respiratory hazards are abound in the workplace, and respiratory protection is vital for employee safety and regulatory compliance. The Occupational Safety and Health Administration, or OSHA regulations require employers to provide respiratory protection training to employees who use respirators in the workplace. Respirator protection is crucial for preventing the inhalation of harmful airborne substances, such as viruses, dusts, fumes, gases, and mists, which can cause immediate or long-term health issues like lung disease or even death. It provides a barrier to reduce exposure risk, especially for workers in hazardous industries, first responders, and the general public during public health crises like COVID-19. Proper fit, medical clearance, and training are essential for ensuring respirators effectively shield users from these hazards. Why is respiratory protection needed in manufacturing? The easy answer is to protect workers from undue harm. A secondary answer is because it's required under OSHA 29 CFR 1910, Section 134. The key aspects of the OSHA standard include medical evaluation, fit testing, training, respirator selection, maintenance and care, and program administration. Respiratory hazards are airborne contaminants, which can cause immediate or long-term health issues, including lung damage, cancer, irritation, or death. The common respiratory hazards found in the workplace include dust and particulates, fine, airborne particles like silica, asbestos fibers, lead dust, and coal dust, gases and vapors, harmful gases such as carbon monoxide and ammonia, and chemical vapors from solvents or paints. Fumes, metal fumes from welding and smelting operations. Mists, chemical steam or spray paint. Biological agents, infectious agents like bacteria or mold spores. And oxygen-deficient atmospheres, environments where the oxygen concentration is below 19.5%. Exposure risks depend on the hazard's toxicity, concentration, and the duration of exposure, with immediate dangers like carbon monoxide poisoning and delayed effects such as asbestos-induced lung cancer. Exposure risks and health effects include short-term or acute effects. Can occur rapidly, leading to symptoms like coughing, wheezing, shortness of breath, headaches, and immediate unconsciousness or death from highly toxic substances. Long-term or chronic effects develop over time, such as lung cancer from asbestos or silica exposure, liver failure from chloroform, or other chronic lung conditions. And immediate and fatal hazards. Substances like carbon monoxide can be fatal within minutes. There are multiple factors that contribute to the risk to the workforce, and consequently, varying factors to limit the exposure to those hazards. The factors influencing the risk of respiratory damage include the type of hazard. Different contaminants pose different risks. The concentration and duration of exposure. Higher concentrations and longer exposure times increase the risk. And the personal susceptibility. Individual health conditions can influence how severe the effects are. The methods of controlling exposure are the hierarchy of controls. Employers should prioritize eliminating, substituting, engineering controls, and administrative controls before relying on respiratory protection. And using the correct type of respiratory protection based on the hazard. Respirators are a last resort for protection against contaminants and should only be used when other controls are not practical. For more information on the hierarchy of controls and other preventive measures, subscribe to Food Sure and see the training video on job hazard analysis. Generally, there are several types of respirators that can be used in the workplace to mitigate the effects of respiratory hazards. They include air purifying respirators, or APR, are filtering face pieces like N95, R95, and P100. These are disposable masks that protect against particles like dust, mist, and fumes but offer no protection against gases or vapors. Elastomeric respirators including half and full face piece. Half masks are reusable masks that cover the nose and mouth and require replaceable cartridges for gases, vapors, or particles. And full face masks are reusable masks that cover the face and eyes, offering eye protection in addition to protection against gases, vapors, or particles via replaceable cartridges. And powered air purifying respirators or PAPRs use a battery-powered blower to pull air through filters, providing a higher level of protection and comfort for extended use. And there are two types of atmosphere-supplying respirators that provide clean air from an independent source. The first is supplied air respirators or SARs. These provide air through a hose from a stationary source, like a compressor or air cylinder, allowing for extended use in suitable environments. And the second is self-contained breathing apparatus or SCBA. These units have a portable air supply tank, offering mobility to the user. Respirator selection is based on a thorough hazard assessment to identify airborne contaminants and determine the necessary level of protection, which must be a NIOSH-approved respirator. Key factors include selecting the right type, for example air purifying or atmosphere supplying, a compatible filter and cartridge for the specific hazard, and ensuring the device provides the correct assigned protection factor, or APF. After selecting the proper respirator, medical evaluation, training, and fit testing are mandatory before use to ensure a safe and effective seal. Some limitations when considering selection criteria of the types of respirators include mobility constraints. SARs are limited by the length of the air hose, restricting how far a user can travel from the air supply. Limited air supply duration. The air supply in an SCBA is finite, with a typical duration of 30 to 60 minutes, limiting its use for very long tasks. Weight of the unit. SCBAs can be heavy to wear, which can add to user fatigue. Cost. ASRs are more expensive to manufacture and assemble due to the complex equipment required, such as air compressors or breathing tanks. Air quality dependency. The safety of the user depends on the quality and availability of the air supply from the compressor or tank. And improper fit. For tight-fitting ASRs, factors like facial hair can interfere with the seal, and proper fit testing and regular checks are critical for proper protection. Regulations directed by OSHA require both a medical evaluation and fit test before an employee uses a respirator on the job, as underlying conditions or the physical strain of wearing a respirator could pose health risks. The medical evaluation is often conducted via the OSHA Medical Evaluation Questionnaire, or MEQ, followed by a physical exam if indicated. The purpose of a medical evaluation is to assess an individual's health and determine if they can safely wear a respirator without risking their well-being due to conditions like asthma, high blood pressure, or a history of heart attack. A healthcare professional will review the medical evaluation questionnaire answers to provide clearance for respirator use. Employers must provide a follow-up medical examination if the employee's responses or initial exam indicate a need for further assessment. A respiratory fit test is a procedure that ensures that a respirator fits properly and provides adequate protection to the wearer. It is required by law for workers who are exposed to airborne hazards that necessitate the use of respirators. The types of fit tests include qualitative fit test, a pass-fail test that relies on the wearer's senses to detect leakage. Quantitative fit test, a more precise test that uses a device to measure the amount of leakage. Factors affecting fit can include facial hair, glasses, and facial structure. Fit testing is typically required annually or whenever there are significant changes in the wearer's facial features or the respirator model. Fit testing must be performed by a trained professional. Employers must provide a variety of respirator sizes and models to ensure a proper fit. And workers must be medically cleared to wear respirators. The fit testing procedure are as follows. The wearer puts on the respirator and is instructed to perform a series of exercises. The test administrator observes the wearer and assesses the fit based on visual cues and the wearer's responses. For qualitative tests, the wearer may be asked to taste, smell, or cough to determine if they detect leakage. For quantitative tests, the evaluating device will provide a numerical measurement of leakage. Those who wear respiratory protection must know how to properly don, perform a seal check, and doff the respirator. The steps to don a respirator are: 1. Inspect. Check the respirator for any damage or tears. 2. Position. Cup the respirator in your hand with the nosepiece at your fingertips and the straps hanging below. 3. Place. Cover your nose and mouth with the respirator, making sure hair or glasses don't interfere with the seal. 4. Strap. Pull the top strap over your head and position it high on the crown. 5. Adjust. Pull the bottom strap around your neck and below your ears, ensuring straps are not crossed. 6. Mold. Using both hands, use your fingertips to mold the metal nosepiece to the shape of your nose, sliding your fingers down both sides to create a seal. And 7. Final fit. Adjust strap tension for a secure, comfortable fit without over-tightening. Once the respirator is donned, a seal check must be performed every time. To conduct a seal check, complete the following steps. 1. Cover. Place hands completely over the respirator canisters, ensuring the respirator is fully covered. 2. Inhale. Take a sharp, deep breath to create negative pressure. 3. Check seal. The respirator should slightly collapse or pull inward toward your face. If the respirator does not collapse, you'll feel air leaking around the edges. And 4. Adjust. If air leaks, readjust the nosepiece and straps, then repeat the seal check. If a proper seal cannot be achieved, do not enter the hazardous area. Improper donning and obtaining a proper seal can render the respirator ineffective and lead to the wearer being exposure to respiratory hazards. The common errors in respirator donning include skipping the user seal check. This is the most common error, which involves not performing the negative pressure test, inhale to collapse the respirator, and positive pressure test, and exhale to feel for leaks to confirm a proper seal. Improperly trained staff. Users may not receive adequate training on how to correctly don and check their respirators. And rushed handling. Users may rush the process or have unconscious habits that lead to skipped steps and a poor seal. Some common reasons and outcomes of seal failures include hair and facial hair. Hair or facial hair, like beards, can interfere with the respirator's seal, preventing it from forming a tight barrier. Incorrect strap adjustment. Straps that are too loose, too tight, or twisted can prevent the respirator from sealing properly against the face. Dirt or debris on the sealing surface. Dirt or other debris on the facepiece can disrupt the seal and reduce its effectiveness. Damaged or worn-out facepiece. An old or damaged respirator may have a facepiece that no longer forms a proper seal. And fogged visor or face shield. Fogged visors can reduce visibility, prompting users to adjust their gear during use, which can compromise the seal and spread contaminants. When the area becomes clear of hazards, or the worker moves to a safe location, it is time to doff or remove the respirator. The steps include 1. Hygiene. The first step is to perform hand hygiene to prevent contamination to the eyes, nose and mouth when removing the mask. Wash hands before touching the respirator. 2. Grasp straps. Use 2 hands to grab the bottom strap, then the top strap, and pull them away from the head to the front. 3. Remove. Continue pulling the straps over your head, allowing the respirator to fall forward. 4. Dispose. Do not touch the front of the respirator, as it may be contaminated. Discard it in the appropriate waste container if it is a single-use device. And 5. Hygiene. Perform hand hygiene again after removing the respirator. Cleaning and maintaining respirators are crucial to ensure they continue to provide proper protection, prevent respiratory infections and allergic reactions, and comply with regulations. It is important for health and safety reasons, as well as maintaining the effectiveness and extended lifespan of the respirator. The detailed cleaning steps for reusable respirators are: 1. Gather supplies. You will need warm water, around 110 degrees Fahrenheit, a mild detergent, a soft bristle brush, a disinfectant solution, and a clean, lint-free cloth. 2. Remove components. Take off the filters, cartridges, or canisters and set them aside, as they are not meant to be washed. 3. Disassemble the facepiece. Carefully take apart the respirator, including speaking diaphragms, valves, and any other removable parts. 4. Wash the components. Wash the face piece and its parts in warm water with a mild detergent. Use a soft brush to gently remove dirt and contaminants from all surfaces. 5. Rinse thoroughly. Rinse all washed components under clean, warm running water to remove all detergent. 6. Disinfect components. Immersing components in a disinfecting solution for 2 minutes is a recommended step for sanitation. 7. Rinse again. Rinse the components once more with clean water to remove any residue from the disinfectant. 8. Dry completely. Allow all parts to air dry in a dust-free area or pat them dry with a clean, lint-free cloth. And 9. Reassemble. Once all parts are fully dry, reassemble the respirator and ensure all connections are secure. For continued use, respirators must be inspected and maintained. The considerations include: before each use, inspect all reusable respirators for proper function, checking for damage to the face piece, straps, valves, and connections. Filter replacement. Replace filters or cartridges when necessary, or according to a scheduled change-out. Deterioration. Elastomeric parts, like the face piece and head straps, should be checked for pliability and any signs of deterioration. And storage. Store respirators in a dry area, sealed in a plastic bag, and do not store them with the cartridges attached to the respirator body. Occupational Safety and Health Administration regulations, through 29 CFR 1910.134, establish the requirements for respiratory protection programs. These programs aim to protect employees from respiratory hazards by providing appropriate respirators, training, and medical evaluations. The key requirements of a respiratory program include: written program. A comprehensive, written program outlining the policies and procedures for respiratory protection. Hazard assessment. Identification and evaluation of respiratory hazards in the workplace. Respirator selection. Choosing the appropriate NIOSH-approved respirators based on the specific hazards. Medical evaluation. Determining if employees are medically fit to wear respirators. Fit testing. Ensuring that respirators fit properly and provide adequate protection. Training. Providing employees with comprehensive training on the following: respiratory hazards, respirator selection and use, fit testing, maintenance and inspection, emergency procedures, maintenance and storage, and record keeping. Some additional considerations for respiratory programs are: employers must provide respirators and medical evaluations at no cost to employees. Employees must follow all program requirements and wear respirators as directed. Respirator use must be monitored and enforced by the employer. Program administrators must have the necessary knowledge and experience to manage the program effectively. By adhering to these requirements, employers can establish and maintain robust respiratory protection programs that protect their employees from respiratory hazards. Respirator protection is crucial for preventing the inhalation of harmful airborne substances, such as viruses, dust, fumes, gases, and mists, which can cause immediate or long-term health issues. Understanding the requirements will ensure an effective respirator protection program. We hope you found this training valuable. Please click the subscribe button to access additional food shore training videos.